As the humanitarian crisis grows in Haiti, the United Nations is sending mobile health teams to help support care facilities in the wake of back-to-back natural disasters. Last month, Haiti was rocked by a 7.2 magnitude earthquake. At least 24 health facilities have either been destroyed or badly damaged. The UN says this has left a huge gap in women's health, especially for reproductive care and survivors of sexual violence. To talk more about this, I'd like to bring in Deputy Resident Representative at the United Nations Population Fund, Judicael Elidje. Judicael, welcome. Great to have you with us. So can you break down the extent of the health crisis you are seeing in Haiti and why the UN is especially worried about women?
Thanks again for inviting us to share this magnitude crisis that Haiti is facing now. As you just pointed out, the majority of health facilities have been damaged or destroyed. And UNFPA and other UN partners and the government are working together to be sure that women and girls are able to get the right space for deliveries and also the safety and security. What I can say is at the very beginning, as the air facilities were damaged, we were able to bring temporary maternity wards and support the healthcare providers so that women and girls can continue to deliver in dignity and safe conditions with basic material. And we are continuing with the government to support these efforts.
And how is the July assassination of Haiti's president adding to your concerns about women's health specifically, and how's that being addressed?
As you know, I think this assassination of the president was another plight of already existing multiple crises and vulnerabilities. Before the assassination, we have the gang violence crisis with almost 20,000 people out there, affecting 1.5 million of people. And the earthquake comes as an additional layer of vulnerability to people. So once again, it has contributed to impact the humanitarian situation, but is beyond the assassination. Haiti is going through multiple crises, and this one is another one. And that's why it's important for all of us, I mean the UN, the government, as well as the international community, to provide support to the government and to people, especially women and girls, and especially those in reproductive health and age, those pregnant women, to get the right services they deserve in dignity. It's also important to ensure that they are safe, because before the crisis, sexual and gender-based violence was almost 12% of women and girls. So it is important, as we are doing now, and give you an example. In some area, those who are living in the tents, women and girls have to remove their clothes to get a shower in front of other people. So we are here with the security, with the police and the women organization to be sure that they deserve the safety in order to avoid any kind of sexual abuse and sexual aggression.
And Judicael, what kind of support specifically will these mobile health teams be giving to the area?
I think the mobile health team mostly targeted those living in rural areas, those who are almost bound to receive easily health care. And the mobile teams are going out there in a regular basis to ensure that those women who cannot reach the health facilities receive the adequate antenatal care and family planning services. Those who have been raped also receive psychosocial assistance and some medical assistance. So the mobile team are there to be sure that the most left behind receive the adequate care and that adequate services. And we continue to support that together with other partners and the government.
Judicael Elidje, Deputy Resident Representative at the United Nations Population Fund. Thank you so much for joining us, and thank you so much for all the important work you're doing there in Haiti.
Thank you again, and we want to really welcome all kinds of support, especially from all over the world, to be sure that women and girls continue to deliver in safe conditions and they live in safety and secure place. And we welcome all kinds of support, and Haiti is needing that. Thank you.